Yes, good morning once again and welcome to our Take Note segment. Now today we have two special guests in the studio and we are going to be discussing something to do with health. So just stay tuned, we are going to be bringing you more information. Now with me is Letasi Prudence, a lady, and a gentleman, Abdul Nfitumukiza. That name is hard, I hope I didn't butcher it. But yes, you are welcome. They are from the Uganda Institute of Allied Health and Management Sciences, Mulago. And like I said, we are going to be discussing all things to do with health. And of course, with the youth. As you can see, we are young faces here.
Yeah.
So we'll be bringing you more information on that. But before we dive into our conversation, please do say good morning, greet our viewers briefly, then we can dive into our conversation. We start with the lady.
All right.
Good morning, Uganda. I'm glad to be here. Thank you for hosting us. My name is Letasi Prudence from Uganda Institute of Allied Health and Management Sciences, Mulago.
You're welcome.
Thank you.
Yes,
Well, thank you very much. Did you know that more than 70% of the diseases that affect people can actually be prevented through changing lifestyle? Well, she said it right. We are going to discuss health. My name is Abdul Nfitumukiza. I'm so glad to be here.
Thank you so much. Now, I think you can start by giving us a little bit more background on the 70%.
Well, thank you very much. Well, I mentioned it that according to the World Health Organization, currently the diseases that are affecting people, to mention but a few, diseases like diabetes, hypertension, urinary tract infections can actually be prevented through changing lifestyle and awareness talks and prevention, you get.
Yes.
So we bring to you something at she said that we are from paramedical.
Yes.
Yeah, we are medics. So there's something we are bringing. I hope we are going to mention about it.
Yeah,
I don't want to rush. Well, yeah, so I'll be diving into more details about the theme of that very subject. And yeah, we are here to understand what I'm actually talking about. Yes.
Now, as we move on to Prudence, why do you think it's important to build a culture, a healthy culture? You know, not just for an individual, but for a whole community. Why do you think that is very important for a nation?
Thank you for that beautiful question. A healthy culture helps build a healthy community. Usually, statistics have shown that there are some diseases that are not just individual-based. These are like communicable diseases, and that affect a large number in the community. And when we have healthy lifestyle, when we also are vigilant about our health, we not only have a healthy lifestyle as individuals, but we create a healthy community for Uganda and the world at large.
Okay. Now, Abdul, she did mention that, of course, it is important for us to have a healthy community, even for us to grow as a country. But how do you think best we can prevent ourselves from, falling into some diseases that could be avoidable? How do you think best we can do that?
Well, that's wonderful. Now, to avoid such, you're triggering me to say something.
Please do.
Well, we are having a very important event happening in Mulago Paramedical School, currently known as Uganda Institute of Allied Health and Management Sciences. We are calling it the Paramedical Health Day Camp.
Yes.
Yeah. So on that day, we expect a lot. And from what she has mentioned, and what you've asked, yes, we expect healthy talks. So from healthy talks, I'm answering your question now.
Yes.
We can actually learn a lot and then prevent those diseases that can actually be harmful to ourselves. Like I mentioned earlier on, the urinary tract infections, the diabetes, and hypertension. Those are very simple diseases that can actually be avoided through learning, having health education, and understand how actually you can avoid such. Understand? Because we believe as medics, prevention is actually better than cure. Yes, and we are bringing this to shift from a sense of curing to a sense of prevention, because prevention is actually the best medicine. Yes, please.
Okay. Now, I do see that there are some objectives that the event has.
Yes.
If you could, I think we can start with Letasi. If you could mention a few key objectives that we have for the upcoming event.
Thank you. The three main objectives of this health day is to educate, provide services, diagnose and treat. First of all, through education, we're going to talk to the community at large about these various infections. How can you prevent them? Right from oral health to community health, personal hygiene. Then we shall also do diagnostics, where we shall screen various diseases like malaria, syphilis. We shall do blood screening, and a few.
Okay.
There will also be an exhibition, and he will tell us more about that.
Okay. And then I think you can tell us more.
Well, thank you so much. This day we are bringing it here. Actually, thank you, Family TV, because this is a very important opportunity to not only us but to the community at large. I actually used the very same opportunity on this note. I think to invite people, our dear viewers of Family TV, to come through on that day. It's going to be 24th of October, this very Friday. We're having a very important event, and we shall be talking health. It's going to be a busy day. Like she mentioned, we shall be having exhibitions and more of awareness. Did you know that there is an occupational therapist? Do you know what they do? Have you heard about autism?
Oh, yes.
Yes, so we shall be having that. Physiotherapists, medical radiologists, medical lab technologists, orthopedic, herself is an orthopedic officer. Yes. Well, we expect a lot, and we call upon the people to come through, and guess what? We are going to be having this day in a way of giving back to the community.
Yes.
All the services that are going to be there are for free. And we call upon people to come through and learn. Health education is very important. Yes, and on that day, like I mentioned earlier, it's going to be a busy day. Yes, we expect healthy talks from various specialists. Like I mentioned earlier on, we shall have physicians educate about health. We shall have community health nutritionists. Yes. Did you know that what you eat can actually also have an impact on your health? Yes. So we shall have to dive into that on that very day. We shall have physiotherapists. Yes. Orthopedic technologists. All of them educating us about health. Yes.
Okay. Now, of course, you did mention that a lot of activities are going to be taking place on that particular day.
Yes.
Now, partners, who have you partnered with to see that this day is actually a success? And you did mention that the services are free.
Yes.
So, just tell us more, a little bit about partners. Are you seeking more partners, or how is the whole thing working out?
Well, let me answer this. This day is organized by the 26th UAHAMS Guild in partnership with the UAHAMS administration. So, like we mentioned, we are here as medics, but on the same note, we are leaders. Yes, and yeah, I think this is the time now. You're seeing leaders providing services, not looking for votes. Yes, sir. We shall be having those services provided by the Your Harms Guild. I hope you know about university leadership. Yes, so this is Your Harms Guild in partnership with administration. Well, we have other partners like Family TV, because we are here. They have hosted us, and yes, we are talking to the community. They are already partners. Yes, and yeah, like she mentioned, I mentioned, the services are going to be free. So we shall be very glad to have you. Yes.
Okay, I'm assuming you're in the guild.
Yes.
You're in the leadership.
Yes, please.
Okay. Now, what prompted you, as the entire leadership team, to see that this is the kind of service we should give to people? What brought about that?
Well, we are medics, and at the same time we are leaders, like you mentioned earlier. So we sat down as leaders, and then we thought about what we can really do to give back to the community. Yes, we are in the 26th guild, and yeah, our term is coming to an end. Yes, so now we have to give back to the community and the students also there. Yes, and on that note, we are very ready to give service to the people. Yes, as the Your Harms Guild, and as medics, as I mentioned earlier, that's the best option we saw, and yeah, we are hopefully it will be a success. Yeah, I forgot to mention about also one other important thing. On that very day, we shall have another very important partner. That's the blood bank, Uganda Blood Bank. We shall be having a team from Nakasero. Yeah, we shall donate blood, and we know very well blood saves lives. Yes, please.
Now let us see. How do you think this? Let me call it an act of kindness. How do you think it's going to benefit not only the people around Mulago, but even the people who are planning to come for the event? How do you think it will benefit them at large?
Thank you. This day will not only impact physically on the patients. People who are going to come are going to learn a lot. Knowledge is power, like we say. Yes. Health education is going to be it's a very powerful tool that people can walk away with, because when you live a healthy lifestyle, that's a wealthy lifestyle. So the community will benefit through getting to know how their body is doing through the virus diagnosis, and they will also get treatment in case they have some issues, some health issues, and we're also going to provide prosthetics too. As you can see, we have people in our community that need some extra support when it comes to motion, so we shall provide artificial limbs too. That's why we're also seeking some partnership with companies that produce these prosthetics. They will work together with our orthopedic technologists to provide those on that day.
Okay, that's quite nice. Now, that is going to benefit the community in different ways, but also, now my question is, where is it going to be? You did not mention the location. Please do tell us where it's going to be, what time our people are actually allowed to, attend the event. Will it be a day's event? Just give us more information on that.
Yeah, thank you very much. This day, a very important day, is going to happen this very Friday, 24th of October, 2025. The time is going to be from 8 a.m. to 5 p.m. Yes, that means a day. It's going to be a day event, and it's going to be happening in Mulago Paramedical School. Those of you who know Mulago, Old Mulago, yes. So we have there gardens, they call dental gardens. But of course, when you reach the gate of Old Mulago, there will be signs. Where there is something happening always, there can be signs. So just reach on the gate of Old Mulago and you will see the event happening, and we shall be very glad to have you. And on the other important note, I want to stress that since it's going to be a very busy day, services are going to be on first come, first serve. Yes, so, and actually bookings are ongoing. And since it's Your Harms Guild, and Guild, is a students association, our first priority are going to be our students. Then we shall go to the community, but still on free. Yes.
You did mention bookings. What exactly are people booking for?
Well, we mentioned the different services that we're going to be offering. Like in radiography, there will be scans, x-rays, and lab, the different tests, and dental shall be having things like extraction and So since students are very near to the event, and they are already booking, and someone will be like, my teeth are paining, so we shall give that person a priority. Okay. Yes, and then those who will come first will get the service first. Yes, please.
Okay. Now, let us see. What advice would you give to someone out there who might not be well, or someone who is healthy? What advice do you give them to maintain that healthy lifestyle?
Thank you. I would advise everyone out there who's viewing that it's necessary to always screen, first of all, to know how your body is doing.
Yes.
Anyone who is not healthy, seek professional advice. Do not self-medicate, because that self-medication is one of the key factors that lead to drug resistance. Most people, when they're sick, like they have a cough, they have a flu, or they have an infection, they will just go to the pharmacy and buy antibiotics. But there is something out there called antibacterial resistance. And it not only happens in an individual level, but it can also become community-based, in that most people in the community are resistant to some specific drug, which will become more costly because we have to now stick to more expensive drugs. That is why when you feel that your body is not okay, go to the hospital. First get diagnosed before you get treated, because that is the most ethical way to take care of your health.
Yes. Now, I think, let me give this to Abdul.
Yes.
What advice do you give to someone who's already healthy? How do they maintain that lifestyle?
Well, someone who is already healthy can actually maintain that healthy lifestyle by monitoring themselves. Sometimes we always have a belief that we shall only go to the hospital when we are sick, which is actually not right. So when you believe that you're healthy, at least do checkups.
Yes.
Like on a monthly basis or 2 months. Always go and do that checkup, full body checkups. Look out how your different electrolytes in blood and etc., how they are standing, and then if you're doing that monitoring every month, trust me, you'll be you can actually easily identify that now there's something going wrong. You get. So actually you can do what? You can seek medication thereafter. You get. But now if you continue doing that monitoring and you're finding out that you're fine, everything, you continue being okay. Yes.
Now, in case our viewer out there wants to see or find you guys, or just communicate with you to get more information, what contacts would you give to them, or what social media platforms are you on in which people can reach you?
Well, people would like to talk to us more. That's what you mentioned. Well, we are found at Your Harms Mulago. Yes, when you reach Your Harms Mulago, by the way, Your Harms Mulago is a giant institution. Yes, we have there variety of medics. So we are very open to discussion with patients. We have there different clinics. When you reach out to UAMS Mulago, you'll find dentists have their own clinic, and actually their services are always ongoing every day. Besides that they are going to be part of this healthy day on 24th, but still, even on other days, we have dentists. They are always there working, still on free.
Yeah. No,
yes.
Particularly for the event, how would I reach out to?
Oh, for the event, you can actually find out physically. That's what I can say, because right now we don't have active social media platforms, because this is a one-day event, which we couldn't actually create a social media platform. But the UAHAMS Guild is always open for people to reach out to. Yes.
Okay. Now, as we wrap this up, let us see what word would you give to our viewer, then even as we complete with Abdul here. Yeah. Ladies first.
Thank you. To our viewers, I would advise them to always keep a healthy lifestyle. Someone who is already healthy, I would tell you to manage your diet and exercise. If your job can't allow, at least get a gym membership or jog every morning or when you can.
Yes.
And I would also advise them to come for a health day, which is this Friday, so that you can educate yourself, learn, and have a good experience altogether.
Okay, thank you. Abdul.
Yes, thank you very much. So our dearest viewers, what I can actually advise you is avoid self-medication. Self-medication is very bad. Yes, it's very, 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 very bad. Actually, when you feel like you're not okay, at least don't take that medicine, because that medicine that you take without knowing actually what is happening in your life can cause you more harm than what you were having. So I'll always advise our viewers that if you feel like you're not okay, please take time, visit the facility, let them do the diagnosis, and then find out what exactly is happening in your life, and then you get the right medication. Because we have had so many cases of drug resistance. Like I didn't mention, I'm in lab department,
Yes.
and then we are the people who have actually been seeing this. Someone comes and tells you, man, I've been having a UTI, I've treated, but the thing is not healing. Yeah, that comes usually with self-medication.
Yes.
But now if you diagnose and you rule out what exactly is happening, you get the right medication, and yeah, you won't suffer from drug resistance and such stuff. Yeah, and lastly, don't forget this Friday, please come through. We shall have a lot. We've not had enough time here to go deep into what exactly is going to happen, but we are going to have many services, medical services, including eye screening and ear, nose and throat surgery, etc. So please come through this Friday, and then we shall be glad to have you.
Yes. Okay, then Letasi will give us something final to say before we wrap up.
For more information and how to reach us, those are the patients, the community, or people who would love to partner with us, they can reach us, the chairperson of this event, using the number 0784 746199.
Okay, thank you so much. That has been Letasi Prudence and Abdul from the Uganda Institute of Allied Health and Management Sciences, Mulago. Now, this is an event that is going to be happening this Friday. So if you're out there, you have a health issue, or you are having some pain, please, screening is not an issue. Just make sure that you pass by, see if you can be able to get some treatment. It is free of charge, starting from the morning till 5 p.m. in the evening, and I think it will go beyond that. Usually it's not 5, but yes, you have an entire day to eat. So if you're out there, please do make sure that you visit, get diagnosed, and of course get the treatment if possible. Now, of course, we do want to say thank you for taking time to come here and for informing us about this. But I guess it is time for me to say goodbye. However, do stay tuned because we are having issues at hand coming right up next, of course, to inform you about what's happening in the country, and of course, many more discussions coming right after that. Otherwise, I wish you a beautiful day, and I will be seeing you later on in the evening.